All right, everyone. Thanks for coming. We're going to wait a couple more minutes. We're expecting a few more people, but then we'll get started. All right, we're going to get started in just a second, everyone. So if you're taking notes, make sure you have your pen and paper beside you. If not, just be ready to listen. All right, we're going to get started now, everyone. All right, so what's up, PF Lab? This is the lecture on states' role in healthcare. In case you forgot who I was from the staff meeting a few days ago, Ian Long. I'm co-leading the Novice Policy Debate Lab, as well as I debated for 4 years at GMU, and now I'm heading into my third year as a debate coach, 2 years at GMU, and I'm starting my third at JMU. Speaking of the Novice Policy Debate Lab, what's up to my boy Zachariah? We miss you. All right, so we're going to cover three big concepts that I want you to leave this lecture having an adequate understanding of. The first is how state governments provide healthcare and like what different types of healthcare they provide. Second, obviously, the advantages of state-based healthcare. What I mean, I don't necessarily mean like solely states giving healthcare, like the status quo model that is, like state slash federal healthcare. But a lot of people make these arguments to argue in favor of a solely state-based healthcare system. So you'll have an understanding of what that argument looks like. And third are the risk factors or disadvantages, cons, whatever, however you want to put it, of a state-based healthcare coverage. All right, so first big concept, the state governments and healthcare and you. All right, so first let's cover the health-related activities of state governments. The first is traditional public health. We'll go into what exactly that is on the next slide, but generally it's sort of stopping any risk factors that could harm the population as a whole. Generally, public health is grouped into stopping and studying disease spread. Next are personal health services. What I mean by that are mostly the funding of things like Medicaid and CHIP, and also just delivery of healthcare as a whole. Next, state governments also provide funding for public hospitals and departments. Those provide healthcare for people that are low income and maybe aren't covered. Next are environmental protections, specifically environmental protections that could possibly have a harm on the population or the health of the people in the state. And lastly, state governments provide regulation of medical care providers. Even private hospitals and hospitals that are federally funded still have to adhere to some state regulations of the state that they are in. All right, first, let's get into public health for just a second. Public health are basically actions that are taken to assure the health and safety of a population. It requires countering emerging and continuing threats to public health. Things that are considered threats to public health generally, things like disease spread. We all understand the COVID-19 pandemic we're living through right now. Natural disasters, right? Public health emergencies are frequently called in response to things like hurricanes. Hurricane Katrina is an example of that. And managing dangerous and risky behavior. What I mean by that are things like substance abuse within a community, making sure that people understand nutritional information so they're, not malnourished, and even things like motor vehicle safety. Like literally anything that is a threat to the lives and safety of a generally large portion of the population is something that falls under the scope of public health. The reason I tell you about this, and to go back to this slide for a second, the reason I'm talking about all of this thing is I want you all to have an understanding that a lot goes into how this provides health care, in quotation marks, for a population, right? Even if you aren't insured by a state government, the state government does a lot of things to provide health and ensure the health of the people that live within that state. All right, now let's talk about some specific state health insurance programs. The two most prominent are Medicaid and CHIP. Both are sort of co-funded by the state and federal government. Now, for Medicaid, offered in all states, it provides health coverage to low-income individuals, families and children, pregnant women, the elderly, and people with disabilities, most notably. Particularly, like the people least likely to be covered under Medicaid are usually like single adults that are healthy, don't have any disabilities. Also based on income as well. CHIP, which is short for the Children's Health Insurance Program, is specifically to provide coverage to children and sometimes pregnant women, depending on the state, that typically don't qualify for Medicaid. Now, the coverage of, I don't know why I did that. In terms of the number of people covered under those programs, about 21% of Americans are covered by these state programs. Now, I made sure to note that was in 2019. I wanted to give you sort of an understanding of how this worked pre-COVID-19, but obviously, given the situation that we're in, I'm sure probably the number of Americans that have applied and are covered has gone up significantly, as well as you can see in the graphic to the right that 21% of the population is covered by Medicaid and CHIP, and it makes sure to note that 28% of the population is low income. So I guess the connection they're trying to draw there is that hopefully, if everything is working properly, most of the low income population within the United States is covered under these two programs. All right, let's talk about public hospitals and departments real quick. Now, there are about 965 state and local government funded hospitals in the United States, which make up about 15% of the total population of US hospitals, according to the American Health Association. Now, public hospitals are important because they are a key part of what's called the healthcare safety net. The healthcare safety net is basically, it exists to provide options to people that are in vulnerable populations or low income, the people that are least likely to have health insurance, right? You want to make sure that they have the option to get some form of treatment. And public hospitals are a big part of that. However, the downside is that they often, almost always, operate at a financial loss due to unreimbursed care that they give to patients. Obviously, since they're treating the most vulnerable and the lowest income, that's probably somewhat inevitable. Also, I need to make sure to mention that public hospitals, due to that fact, they operate at a financial loss, tend to be closing at a faster rate than the rate of hospital closures as a whole. Is that a question, or does someone just leave their mic off? All right, let's go into the advantages or the pros of sort of state slash federally funded healthcare or just state healthcare alone if you wanted to. All right, so key benefits are specialized and local knowledge. We're going to go into all of these, but generally just having an understanding of what the community needs. Next is existing infrastructure. Since states and the federal government already play a role in funding things like Medicaid, there's an argument to be made that if we were to transition to, federal single payer, that would completely overhaul the existing infrastructure for healthcare delivery, right? And people make the argument that instead of that, why don't we just expand states' role in the existing infrastructure like Medicaid? And lastly, federalism, which is just this idea that states should be able to act independently of the federal government as much as possible. All right, so to go into a few specifics. So for specialized knowledge, people argue that focusing on state-based healthcare can lead to sort of more community-based approaches. It leads to lasting connections between insurance regulators, the primary care physicians, and the patients. And as well as they argue that states can ultimately be a little bit more flexible in how they choose to fund these programs. They argue that state insurance regulators are better equipped to understand the unique needs of their states, are more accountable to the people of their states, and possess greater flexibility than federal officials to experiment and adapt laws to local conditions. Next, infrastructure. Sort of like I mentioned before, people argue that it is easier and probably net better to grow the pre-existing role of the state in health insurance. So things like expanding Medicare and expanding states' role in the funding of Medicare rather than it being sort of more of a joint venture between the state and federal government, as well as the argument that single payer completely changes the healthcare delivery system. A key disadvantage, or I guess impact of that, is they argue that that could lead to contradictions in sort of state regulations on healthcare and federal regulations on healthcare. All right, next, federalism. All right, so federal single payer, there's no question it expands the size of government significantly. And a lot of people don't like that. They think that single payer is an overreach of executive power. So specifically, federalism can be defined as the division of power between states and the federal government, right? It allows states to exercise authority in their territories as much as possible. So things that you could use as evidence of single payer being an overreach, There's an example of the fact that 20 states sued the federal government over the Affordable Care Act, claiming that it was unconstitutional. So, federal insurance programs usually create sort of a division between the state and the federal government. As well as they argue that as that program grows, it could lead to further overreaches and a heavier hand of the federal government. All right, let's go into a bit of the disadvantages of the cons of, I guess, not switching to federal single payer. All right, so generally the talking points here are about a lack of uniformity. They sort of claim that a state-based system is only a patchwork solution. Instead, we should have, single regulation and action across the board. States have limited budgets to allocate to healthcare spending. And as well as we see under the current model that there are still millions of people that are uninsured. If you take the state-based healthcare approach, you have to be able to answer to that. All right, now specifically for no uniformity, basically the general argument here is that without uniform action, that inevitably leads to disparities in affordability, in options, in health outcomes, right? They argue that can affect people along racial lines, economic lines, obviously. So that's a general argument there. In terms of restricting budgets, a big deal is made of that because year to year, we see that healthcare costs are generally rising, where state and local budgets can only allocate so much to healthcare. One second, I see someone raise their hand. Is it Ria?
Yeah, could you go back one slide real quick?
Oh, sure. Let me know when you've got everything.
Okay. Wait, I can't see it.
Oh, sorry. Can you see it now?
Ian, you aren't sharing your screen.
Oh. Have I not been sharing my screen this whole time? What just happened?
No, you have been. You stopped sharing it in order to look at the
I see.
Blackboard.
Thank you.
No problem. All right, so restricting budgets or restricted budgets. Healthcare costs year to year are rising. People argue that state and local budgets sort of can't rise to meet that need because obviously state and local governments have to do a lot of things. And as well as the fact that public hospitals are proven to be severely non-profitable, people argue that states simply don't have the financial capability to take on the burden of solely providing healthcare to the entire population. All right, and lastly, uninsured Americans. All right, so it's empirically proven at this point due to the Affordable Care Act, as well as what we see in other countries, that federal healthcare interventions produce a lower rate of uninsured Americans, i.e. more Americans, or more people with insurance, I should say. So under the ACA, the rate of uninsured people declined to a historic low by 2016. If you look to the graphic to the right, you can see that 2013, right before the ACA went into effect, unemployment was at 44.4 million, and then it dropped off in 2014 to 35.9 million, and then generally had a downward trajectory up until 2016-17, where it rose slightly by 500,000, but we still see that that is significantly less than the 44 million that it was before. Now, definitely an argument to be made that the ACA mandated that people enroll or they pay a fine, but generally what we see here, as well as examples from other countries with universal health care, we can say almost with certainty that it leads to lower rates of uninsured Americans. All right, and lastly, let me give a quick overview of the talking points. All right, so for federal health care, if I wanted to lay out in an opening statement what my case was for federal or single payer healthcare, right? It has the benefit of uniformization and regulation that reduces the likelihood of disparities, right? Larger budget to allocate, and it's empirically proven to decrease the number of uninsured Americans. On the flip side, for state healthcare, You should argue that state governments reap the benefit of having a pre-established healthcare infrastructure, specialized knowledge of the needs of their communities, and that they stay in line with the American creed of limited federal intervention, i.e. federalism. All right, now that's all I got for you for right now. You can hit me up at any of these two email addresses if any questions, or actually, no, we're going to do a question and response period now, and then I have a Kahoot for y'all to do if we have time left over, which we probably will. Yeah, open for questions if y'all have them. Otherwise, we can do a Kahoot. No questions? All right, that's cool. I will post a link to the Kahoot in the chat. Please join. Or I'll post the game pin link, I guess. All right, is everyone that wants to play in? If not, raise your hand and we can wait just another second. All right, so everybody's in? All right, then we'll get started. So my Kahoot's probably a little bit different from what you're used to. There'll be some educational stuff in here, but there will also be other things. Okay, I see where we might have gotten thrown off just a little bit here. All right, so the answer is funding private hospitals because states, their main purpose isn't to fund private hospitals. Maybe through some means they might give them money, but that's not what I'd consider health-related activity. Environmental protection, the reason that is not a correct answer is because it falls under things like public health, preventing natural disasters. So that is a health-related activity in state government. Right. It's actions to keep people safe and healthy generally. Now, a lot of people sort of pigeonhole public health into sort of it's just about stopping diseases, but I think it's beneficial for us to have a more broad view that the scholarship of public health is about how to basically stop all, or not stop all reasons, but try to mitigate all factors for why a large portion of people die or are unhealthy. So things like nutrition, things like motor vehicle safety, all fall under that umbrella. Right. Medicare is a federally funded healthcare program. Medicaid and CHIP are both jointly funded by the federal government and state governments. That's right. On the slide, it was 21%. Now, I threw 20% there to be hard because I said about 1 in 5, but the answer is 21%. It makes me really happy that someone chose Jeff Bezos. Let's be real. This thing does look like Jeff Bezos. It does. Thank you, Zane. I appreciate you leaning into the meme with me. That's right. Answer was 965, according to the American Hospital Association. I might have said American Health Association during the PowerPoint, but the American Hospital Association. All right. Public hospitals are not profitable in the status quo. Yep. And public hospitals are decreasing. All right. I know this is PF. This isn't big questions debate or anything, but I got a big question for y'all coming up next. I hope you're ready. Think carefully about this one. Twice as many points.
I watched a whole video yesterday on this, so.
Oh no. Silly PF debaters. Tupac isn't dead.
True. He lives in Cuba.
See, and this is the truth. Like, I would never lie to you. I want you to remember that. Ian would never lie to
Everyone say yes. Ian would absolutely lie to you.
Look, see, this is a teachable moment. I want y'all to remember, trust nobody. Not me, not even yourself. Oh, Aaron with a comfortable lead. That's right. Single adults are generally the least likely to be covered by those two programs. That's right. State healthcare does not benefit from uniformity. Oh my goodness. Will anybody dethrone Aaron by the end of this? Let's find out. That's right. 44 million. That's right. Year to year, healthcare costs are rising. Wow, I'm upset that I misspelled Noah's name somehow. That shouldn't have happened.
Bro, they don't even know who Noah is.
But yes, you do.
No, I do. No one else does.
Well, yeah, I know. It's an inside joke, Mac. Hey, that's Aubrey Graham, all right, aka Drake,
All right,
aka the GOAT. Hey, 4 people chose Kanye and 2 chose Lil Nas X. Come on.
Kanye's face was literally in one of the photos.
What? Not that photo.
No, like the Kanye 2021.
Yeah, but that wasn't Kanye West in the photo I just showed you. What are you talking about?
Exactly.
Oh wow! Thank you all for electing me the best GMDI staff person. I humbly accept this award, and thank you all for your time. All right, let's see who the top 3 are. All right. At the end of the day, Aaron took that lead and ran with it. No one could dethrone him. Oh, almost closed the wrong tab. All right. And without further ado, that's all I got for y'all. So if we don't have any questions, I'm not sure if Hannah wants to take over or we can just take our take a break before what's it, morning lab? Anna?
Hey, can you hear me?
Yep.
Awesome. All right, so we have a little bit of extra time left over, so what we're going to do is go ahead and take our break. I guess we'll have a little bit of a longer break now, and then come back at 11:10 to your morning lab rooms. Thank you, Bishop, for leading the lecture on the states and healthcare. It was great. We enjoyed it. And I will see everyone at 11:10.
All right. Peace out, everybody. I'll see you later. My boy
Thank
Zachariah.
you. Thank you.
Thank you.
From
Thank you.
Thank you.